Do you know someone who may be feeling sad and you're not sure if the sadness is depression or just normal sadness? You want to have a self assessment tool or a quiz that can tell you, give you some idea if this could be depression, so you can decide if you need to get treatment or take some other measures. Well, then you're in right place. Today we are going to talk about a simple self assessment tool or a quiz that can help you decide if what you're noticing could be depression or something else, and how severe it is, so you can decide and seek treatment in timely manner and you don't have to suffer unnecessarily. Hello friends, my name is Dr. Rosina and I'm a medical doctor with specialization in psychiatry, a clinical professor, and a best-selling author. You are watching Happy and Healthy Mind. I bring you tips for your mental fitness every week, and if you'd like to be reminded, do remember to click like, subscribe, and the bell button so you can be reminded whenever I post a new video. So today we are talking about simple self-assessment tool for depression. So what is depression? Well, depression is a mental disorder where a person feel really depressed and sad and their functioning is affected by multiple of other symptoms. It becomes really confusing in our culture because a lot of times sadness and depression are kind of used interchangeably, and people get confused in terms of what they're experiencing is normal emotional reaction of sadness, like if you don't pass an exam, or if your TV is not working, or somebody said something, or god forbid somebody passes away, you hear a bad news. Sadness is a normal emotional reaction. So if you don't feel sad when something sad happens, that may be abnormal too. But when that sadness continues on and you're not able to pull yourself out, or sometimes sadness happens for no reason, then it could become depressive disorder. And it's a biological disorder that also has treatment. So it's important to catch it in time so you can get the necessary treatment and you don't have to suffer unnecessarily. So, how do you find out? So, one of the simple self assessment tool that we use is called PHQ-9. So, what is PHQ-9? It's a 9-item questionnaire. You can call it quiz or a test that you can use to assess what you're noticing is depression or not. It's PHQ stands for Patient Health Questionnaire, and because there are 9 items, it is called 9. There's also something called PHQ-2. That is something that a lot of primary care physicians use in their office, which consists of the first 2 questions out of this questionnaire, because one of them is necessary for the diagnosis of depression. So if you answer no or zero for both those questions, then it's less likely that you may have depression. All right. So, how do you do this test? So, as I go through the question, it may be helpful for you to do it with me. So, why don't you grab a paper and pencil? And every time I ask a question, you can score yourself from 0 to 3. So, you can say 0 if that problem is not at all a problem for you and you have not experienced that much over last 2 weeks. You can score it 1 if you have experienced that problem several days over last 2 weeks, or maybe 25% of the time. You can score 2 if you have experienced that for more than half the days or 50% of the time, and 3 if you have experienced that nearly every day. All right. So are you ready? So what's the first question? So the first question is, over the last 2 weeks, how often have you been bothered by little interest or pleasure in doing things that you used to enjoy in past, but somehow you're not finding joy and pleasure in those things? So go ahead and score yourself either 0 for not at all, 1 if several days, 2 if more than half the days, and 3 if nearly every day. All right. So, what's the next question? Over the last 2 weeks, have you been bothered by feeling down, depressed, or hopeless? Again, score yourself from 0 to 3. 0 if not at all, 3 if nearly every day. The third question is, are you having trouble falling asleep or staying asleep, or maybe sleeping too much? If you're having trouble not at all, then 0. If you're having trouble sleeping several days over last 2 weeks, then score yourself 1. If you have had trouble more than half the days over last 2 weeks, then give yourself 2. And if you're having trouble sleeping almost every day, then give yourself score 3. Number 4 question is if you've been feeling tired or having very little energy. So again, if you've been feeling really, really tired nearly every day, give yourself 3. More than half the day, 2. Several days, 1. Not at all, 0. Next question is poor appetite or overeating. When people are depressed, either they start eating too much or too little. If your appetite has been affected almost every day, give yourself 3. More than half the day, give yourself 2. Several days, give yourself 1. And not at all, then 0. Question 6 of this quiz is over last 2 weeks, how often have you been bothered by feeling bad about yourself? Feeling that you're a failure, or feeling that you have let yourself or your family down, having really low self esteem. And if you're feeling that almost every day, nearly every day, give yourself 3. More than half the day, give yourself 2. Several days, give yourself 1. And not at all, then give yourself 0. Item number 7 on the scale is if you're having trouble concentrating on things such as reading the newspaper or watching television, or general things that you do. Are you having difficulty focusing on those things? And if that trouble is happening nearly every day, give yourself 3. More than half the day, give yourself 2. Several days, give yourself 1. Not at all, give yourself 0. Item number 8 is are you having difficulty moving or speaking so slowly that other people could have noticed? Or you're so fidgety or restless that you have been moving around a lot more than usual? And again, if that has not happened, give yourself 0. If that happened several days out of last 2 weeks, give yourself 1. More than half the day, give yourself 2. And nearly every day, give yourself 3. And question number 9 is if over last 2 weeks have you been thinking that it would be better off dead, or that you would want to hurt yourself in some way? If you have not had that problem, give yourself 0. And you have had these thoughts several days, then give yourself 1. If it has happened more than half the day, then give yourself 2. And if it has been happening nearly every day, then give yourself 3. And overall, all these symptoms that we just talked about, how difficult have these problems made it for you to do your work or take care of things at home or get along with other people? Not difficult at all, somewhat difficult, very difficult, or extremely difficult. All right. So, why don't you go ahead and total all your score and see what your score is, so I can tell you what this score means for you. So, is your score less than 5? If your score is less than 5 and or you haven't had trouble with these symptoms, then most likely you don't have any depression. But if your score is between 6 and 10 and you are having some difficulty in functioning, then you could have potentially mild depression. If your total score is between 11 and 15 and your functioning is affected, that most likely you may have moderate depression. If your score is between 16 and 20, you could have moderately severe depression. And if your score is more than 20, you most likely have severe depression. Again, you cannot be sure that this is depression because a lot of these symptoms could be overlapping with some other disorders. You could have anxiety disorder with depression, or just stress reactivity, professional burnout. You could have bipolar disorder, or some kind of hormonal deficiency like thyroid deficiency or vitamin D deficiency that could be causing these symptoms, or you could have substance induced mood disorder. And therefore, it is very important that if you feel that you're scoring high, it's important to see a professional so that they can make a proper diagnosis and recommend the treatment. So, what can you do next? So, if your score is, let's say, less than 10 and you want to do some self management, then you can start working on having happy and healthy habits and start working on your stress management that may help you get out of depression by yourself. But if your symptoms are getting into moderate or severe level, it's very, very important that you get into treatment. And once you see a professional, they may be able to guide you what level of treatment you need. Maybe you need psychotherapy, maybe you need medication, or maybe you need some advanced treatment. And it is very important, if you're having suicidal thoughts and you feel like you're not going to be able to control yourself, then it's very important to get yourself into a safe facility like a hospital or a treatment program, so that you can get out of that crisis situation, get over your suicidal thoughts, and get over the risk of hurting yourself, and then you can continue to work on getting better from that viewpoint. These self assessment questionnaires are easily available, but if you would like me to send you the link, you can text me joyful at 38470, and I'd be happy to send you the link to the questionnaire and other resources that I have developed for people suffering from depression. I made several videos where you can learn more about disorder and what steps you can take to prevent depression and treat it in early stages so you can prevent unnecessary suffering. And I've put the links in the description below. Remember, depression is a treatable disorder. You do not have to suffer alone or suffer unnecessarily. Every step that you take will take you towards being happier and healthier. So take the step today. You can do it. Till next time, Dr. Rozina.